Now, new figures show satisfaction with the NHS has fallen to a historic low, with only a quarter of the British public believing that the health service is working. Experts said people felt trapped in a toxic relationship with the NHS, supporting the institution in principle, but increasingly fed up and anxious because of its failures. Well, the annual report by the King's Fund and the Nuffield Trust think tanks found that public confidence in the health service was at its lowest since polling began in 1983. Earlier, I spoke to Dr John Puntis, co-chair of Keep Our NHS Public and a retired consultant paediatrician. And I started by asking John what he made of the latest findings.
I don't think it's surprising. A lot of it is due to people finding it difficult to access services, GPs, but also hospital services, waiting for investigations, waiting for admission. We have this waiting list now of 7.8 million. The question really is, why was satisfaction 70% in 2010 and why has it fallen to 24% now? But clearly the dissatisfaction relates to the NHS just not performing well at the moment. And I think there's reasons for that. And the biggest reasons, I would say, is chronic underfunding and chronic understaffing. Without staff, of course, you can't deliver services. We know that there's something like 120,000 vacancies at the moment.
Clearly, funding is a big issue. But of course, what the government, what ministers have been saying is that they are still coping, of course, with the after effects of the pandemic. And as I'm sure you're well aware, so many routine appointments were cancelled during the pandemic. And then also, of course, we've had the health service strikes, which have made it much more difficult to make inroads into those waiting lists. So it's not just about funding, is it?
Well, let me, if I may, just go back to the concept of the toxic relationship and then come back to the funding point. So what this survey showed is that people actually support the founding model of the NHS. 91% want to see an NHS where services are free at the time of use. 82% want to see it funded out of general taxation. Nearly half people identify not enough staff. In fact, 54% not enough staff and 47% not enough money as being major problems. So I think the issue is that they know that the NHS has worked well in the past. They're not convinced by arguments that there should be a fundamental change in the model, but they can see that it's not working well at the moment. Now, it is completely wrong, I think, to say everything was fine. I appreciate you didn't say this specifically, but to suggest that everything was fine until COVID wrong.
Well, I'm just pointing out that is one of the things that the government points out, that the pandemic caused a huge backlog of routine appointments, and that has added to the difficulties, hasn't it? John, I mean, there are so many different aspects of this, but if, as has been pointed out in the survey, and as you have pointed out, people do support the principle of the NHS, but they're not happy with the way it's working, isn't sorting social care one of the really important aspects of this? Because we know that there are many people who are in hospital who could indeed be in social care, but there just aren't the places for them there.
Yes, that's absolutely true. So about 1 in 7 patients in hospital. In some hospitals, up to 30% of inpatients fit to go home but can't because of lack of social care. So that's fundamental. But I do want to come back to you about the pandemic, because the waiting list in 2012 was 2.4 million. By the time of the pandemic, it had gone up to 4.6 million. Now, I'm not saying the pandemic hasn't made things worse, but one of the things we learned from the pandemic is that the NHS was really in a weak situation and not well prepared to deal with the pandemic. And conventional WHO teaching about health services is that you have to have the capacity to be able to continue with normal work and absorb the extra demand that comes along if there is something like a pandemic. So we could go down that road about lack of preparation and lack of investment. But I think the government are using the pandemic as an excuse rather than as a serious explanation.
John, let me ask you about that question of whether it's a sufficiently high political priority. The authors of the report are saying that political leaders should take note of public attitudes on this. And we know that people really care about the NHS, but it's just that they're very frustrated with the way that it's working. Do you think there should be more imaginative solutions, more cross-party working, especially on something like social care that does require a long-term solution?
Yes, I think politicians are out of step with the public. The public actually want to have a properly funded NHS, and they do want social care sorted out as well. And a lot of politicians are talking about the model of the NHS needing fundamental reform, and that's clearly not what most people want. And the NHS, I think, has become the first issue in terms of voters' concerns in relation to the coming election. And this is a period where I think we need to argue that politicians need to say much more about how they're going to repair and restore the NHS. And I think if they want to advocate an alternative model, they have to show us the evidence. I think they'll find that very difficult to come up with, but they really need to take an evidence-based approach to healthcare. And I think if they did that, they would come back to the founding model of the NHS once again. Funding, if I could just come back to that, I think it is really crucial. It is not good enough saying record amounts of funding. We know that record amount of funding is not enough. My hospital had 105 sewage leaks in 1 year, with excrement bubbling up through the floor tiles in one of the clinical areas. And this is because it's in very old buildings. It has a maintenance backlog of 189 million. That's one hospital. Nationally, the maintenance backlog is 11.5 billion.